Good morning, everyone. Welcome to Coffee with Marci. So glad to have you guys back with me today. I am here with Dr. Park Avenue.
Morning.
And we are here in Franklin Lakes. So I'm excited to hear how you got the name Dr. Park Avenue.
Well, the vast majority of my time in practice was on the Upper East Side of Manhattan. And I always had an office on Park Avenue. So I thought it was a catchy name, and when I made the move to New Jersey and gave up my prior practice and started dealing with cosmetics, I thought it was a good name with the connotation that you no longer have to go to Park Avenue to receive Park Avenue services. And so now with 3 facilities in Hoboken, Franklin Lakes, and Brick, we can deliver Park Avenue type service in our more local facilities.
That's great. I love that. And now your nickname's Dr. Park Avenue, right?
Yeah, even though my real name is Dr. Paul Fondacaro.
Exactly, Dr. Fondacaro.
People often refer to me as Dr. Park or Dr. Park Avenue.
That is great. Well, you have a lovely facility here.
Thank you very much.
Absolutely. So I'd love to hear a little bit about your background, maybe your schooling.
Absolutely.
And I know you had some surgical background before you started here.
Yes. I'm a graduate of New York University School of Medicine, where I was lucky enough to meet my beautiful wife. She was a first-year medical student when I was a third-year medical student, and I invited her for coffee up in the hospital cafeteria, and the rest was history. And now
great.
She's a professor at NYU.
Oh, wow.
And I'm here making people beautiful.
I love that. I love that.
Yeah.
So prior to this, though, you were a vascular surgeon, correct?
Yes, I performed vascular and general surgery at Lenox Hill Hospital. I was very fortunate. Sometimes things go more by luck than by skill. I fell in favor with one of my professors who took me under his wing and was made chairman of surgery at Lenox Hill Hospital. And shortly after he established himself there, he invited me to join him, and I became assistant director of surgery at Lenox Hill, and I was in charge of training residents in the Department of Surgery at Lenox Hill Hospital. So
that's great. So how did all of this start, though, right? You met with someone and...
Yeah. A good friend of mine, we were very good friends, we're still good friends.
Yeah.
We went through medical school together, we did our residency together. I was best man at his wedding, and he started a transplant program at St. Luke's Hospital, but unfortunately the hospital was taken up by Columbia, and he lost his position despite the fact that he started a very successful kidney transplant program. So back in 2003, we were commiserating about how do we protect ourselves against circumstances such as this. And as everyone knows, medicine's changing. We no longer feel like we're in control of our patients. Every time I would have to order a test or admit a patient, I would have to get permission from an insurance company or the hospital itself. So I felt like I was sort of pushed aside, and I was no longer a physician. I was a provider. And I didn't go to provider school. I went to medical school. And it came to a point where I felt that I lost control of my practice. I was being told by third parties what's best for my patients. Yeah. And that just didn't sit well with neither myself or my friend. And being that we worked on the Upper East Side, I was mentioning to Marci that you'd be hard-pressed to find a gynecologist who wouldn't offer cosmetics to their patients because they had the right demographics.
Right.
Dermatologists would offer fillers and Botox. Gynecologists would offer hair removal and Botox to their patients. And so my buddy and I figured, well, we do vein treatment for varicose veins, why not do cosmetic veins? And that's how it all started. That was the beginning of starting my cosmetic practice. And that was back in 2003. And we started with laser ablation of varicose veins. And it was an office procedure. So what used to be a hospital-based procedure where we would cut down, it wasn't pretty surgery.
Yeah.
It was sort of gross. You would cut down on the ankle vein and on the groin, and you basically stripped the varicose vein. And that was the way varicose veins were taken care of for many, many years. But then it became more of a nuance where you would use an ultrasound and a laser, and you would just place the laser through the skin into the vein, and you would close up the vein with the laser. And that's how we first started. And then things started to develop. We started including Botox in our practice, fillers, various other techniques. We invested in a laser to do laser hair removal. And then the real turning point was around 2006, 2007, when this company received the first FDA approval for laser liposuction.
Yes.
The company's name was Cynosure, and they coined the phrase smart lipo. And I saw that as a real turning point for my career.
Yeah.
And patients would come in, they would tell us what their concerns were, and we could take care of them. We didn't have to call up and get permission and get approval and go through all the hurdles that every doctor to this day has to go through.
I know.
And
the
I'm having
has really changed.
absolutely.
For sure.
And Marci, I can't tell you how much fun I'm having now, because
that's wonderful.
even though I did my share, and I'm very happy that I saved a lot of lives. I dealt with cancer. I dealt with all sorts of life-threatening diseases, and for my 60th birthday, I had a room full of people, and half of them were patients that I had operated on.
Oh, wow.
And
really?
it really made me feel good, you know. When after they roasted me, you know, I gave it back to those who roasted me, but I also thank all those who showed up, and these were people who were my patients. And they came to support me during my surprise 60th birthday. I don't know how they pulled it off, but it
that's
was
a lot of fun.
It was a lot of fun,
Yeah.
and it's a day I'll never forget. But going back to what I'm doing now, I'm having more fun now than I did as a general surgeon. I think,
Right, you're making a difference in another way, right? You're
absolutely.
empowering men and women. You're making them beautiful on the outside, and that helps them. If you change, you know, what they're unhappy with, they walk out of here and they have a different confidence level.
You're absolutely right. And one thing I always tell patients is a little story about the Depression of 1929. For those who are into history or those old enough to remember, people would sell apples on the corner just to get by. But yet they would put aside that nickel to buy lipstick.
Yeah.
That's all it took for
Yeah.
patients to feel good about
Yeah.
themselves,
Yeah.
to give them that self-esteem.
Yeah.
And it's the same thing that we do here.
Yeah.
In fact, if I can just tell a little story about a patient of mine who I took care of for quite a few years down in our Brick, New Jersey office. She unfortunately lost everything during Superstorm Sandy.
Oh, goodness.
Lost her car, lost her home, lost all her belongings, and she was by herself. I don't remember if she was a divorcee or widow, but she happened to call and she told me what happened. This was 7 months after the storm, and she said, I decided I want to do something for myself, you know, something to pick me up.
Yeah.
So it happened to be a Thursday, which is the day I'm down in my brick office. And I told her, why don't you come right over? I'll take care of you right away.
Oh, wow.
And I treated her with Botox. I treated her with fillers.
Yeah.
A week later, she calls me, and I still remember, she says, that was the best antidepressant I could have had.
It's true.
It really picked
bet
her
it
up.
was.
It made such a big
Yeah,
difference.
it does
for
make
her.
a difference.
Yes.
So that kind of leads me to what I'd like to talk about next is the procedures that you offer and what exactly they do. So you brought up Smart Lipo.
Smart lipo.
And I think that there are a lot of women and men that would be excited to know about that. It's not like the old procedure where they're putting these huge rods in you. And,
Absolutely.
Yeah.
Absolutely. Whenever people hear the word hear the word liposuction, the first thing in their mind is, ooh, I've read or I heard that people die from liposuction. And you know what? People did, unfortunately, few did die from liposuction. But we're talking about the 1980s when it was first brought in from France. Excuse me. And the American plastic surgeons went over to Paris, learned how to do it, came back, picked up like wildfire. But remember, it was a hospital-based procedure. And back in the 80s, the only way to treat these patients was with general anesthesia. Now, general anesthesia has improved dramatically. They don't just measure your rhythm, your pulse rate, your blood pressure, but your oxygenation, your carbon dioxide. So it's very safe. But if you poll surgeons in general and say, if you needed your hernia fixed, would you rather undergo general anesthesia or local anesthesia? I bet you 99 out of 100 surgeons would say, I'd rather undergo local anesthesia. So one of the main improvements with Smart Lipo is we completely do away with general anesthesia. You don't see blood clots anymore in the legs. You don't see pulmonary embolism. You don't see fat embolism. People aren't black and blue for weeks on end. These are all the pitfalls of liposuction. And as Marci alluded to, they used to use large cannulas that would have to break up the fat in order to suck it out. This is more finesse. And the advantage of it is it's now converted to an office-based procedure. No longer does someone have to go to a hospital or a surgery center, but they can go two rooms down, have it done, and walk out that very same day. The only thing they can't do is drive, because we do give them a little Valium and a little Klonopin to take the edge off. But it's all done under local anesthesia. The other advantage is we can address the skin. Whereas with conventional lipo, it's like deflating a balloon. If you deflate the balloon wall now is loose. And that's what happened with the skin. You get a lot of sagging skin. What I use is the state-of-the-art laser called the triplex Smart Lipo laser. And the reason why it's called triplex is because it contains 3 separate lasers. One laser to melt fat, another laser to cauterize blood vessels, so that minimizes the amount of bruising, and the other laser, which is the new addition to the triplex, is the laser to tighten the skin. So once I melt the fat, I go ahead, tighten the skin, stimulate collagen, and not only do we remove the fat, but over a period of time, because that's a healing process, the skin also conforms. So
that's incredible.
That's an amazing procedure.
So another thing the doctor was telling me about the Smart Lipo. So there's really only 2 small holes where you insert the rod for the anesthesia, the local anesthesia. And so, and this can be done anywhere. This can be done on your stomach, your legs, your calves, your love handles. Underneath here, under our arms, where a lot of women have that problem. Reshaping even the arms. So liposuction, I think we used to always think of just the backside and the hips and that sort of thing. But this can be done all over to reshape different parts of your body. And we all have different, fat pockets, more fat cells in different areas than other people do. Everyone is different.
Everyone is different. And believe it or not, I have a connection down in the Brick office with a gentleman who's a personal trainer for bodybuilders. Now, these are people that work out in the gym every single day. They eat 7 times a day using little Tupperware bowls to increase their metabolism. And yet, despite all the working out and the building of the muscles, there are still pockets that they can't get rid of. And any certified personal trainer will tell you that it's almost impossible to spot reduce. And one of the biggest problems, especially in men, that we have are the love handles, the muffin tops. And I can't tell you how many times I see people at the gym with dumbbells doing side bends. And that's the worst thing you can possibly.
That just builds it up, doesn't it?
Absolutely
right. I've heard that.
Because you're building your quadratus muscle, you're building your obliques. The fat sits on top of the muscle. So what you're doing is you're building the muscle, but you're also pushing the fat out. So you're actually making things worse. And every so often I would go up and I would tell someone at the gym, please don't do that because that doesn't help. I stopped doing it because someone once told me where to go. So after that, I said, all right, good luck to you. But
you're the doctor and they still want to say they know better, right?
But that is really the way to go. And if I can use a perfect example, if people are history buffs and they look at World War II movies, When the Russians liberated the first prisoners from the concentration camps, you saw those poor souls. They looked like walking skeletons.
Yeah.
You could see all their ribs. But once in a blue moon, you'll see somebody with love handles. And you say, how in the world can someone with no fat have love handles? And the answer is simple. It's genetics. Genetics basically determine where the bulk of your fat cells are. Very few people in this world have an even distribution of fat cells. So if you see someone who's very thin, such as in the example I gave, what it tells you is that the genetics made them predetermined to have the bulk of their fat cells in their love handles, despite the fact that they have fat nowhere else.
Right.
And so it begs to differ that no matter what you do, you can't get rid of those things. So
there's a lot of ladies and men also, like you were talking about in the gym. We work out really, really hard, and obviously our metabolism changes with age, and we have children. Our bodies change with that. I know a lot of women, as much as they do, they still have trouble in their midsection.
Absolutely.
Or maybe on their hips. And this procedure, literally, he puts 2 holes in. He does the procedure, melting the fat and then tightening the skin. And then you have something that you wrap around, let's say it's your middle area. So you would wrap that around, and then you're able to leave. The only thing you can't drive because of the sedation. But then, like, you told me one of your patients was back in the gym like 2 days later.
It's one of my favorite photographs to show. In fact, we have one of our posters on the window, and it's a gentleman, and I'll never forget, right here in this very reception room, he walks out and he puts his arm around me and he says, "Doc, when can I go back to the gym?" And I told him the same thing I tell all my patients. Let your body be your guide. Which means if you feel up to it, you can do it. The only thing a patient can't do is wear that compression garment that you were alluded to. Because it's the same. I love to use analogies. It's like if you glue 2 pieces of wood together, you put a vise to allow the wood to seal evenly. And that's what you want your body to heal. Because now there's that area, which, believe it or not, the medical term is dead space, where the fat used to be. So you want everything to come together and contour as evenly as possible. And that's where the compression comes in. So as long as someone wears a compression garment, they can do whatever they want. And we tell them it's mandatory that they wear it for 2 weeks straight. 24 hours a day. They only remove it when they take a shower. Even using the restroom, there are flaps that are built in that they can use. So they don't have to remove the compression garment, only when they take a shower. And then we see them 2 weeks later, and that's where my favorite part comes in, where we're sitting together looking at the before and after pictures and seeing that smile come across their face. Like, oh my God, I can't believe I look like that.
Because you work so darn hard, and then you don't see the results, and then finally you get to see those results. And like you had said, a lot of people can't change the genetics of their body. So this is a procedure that would be right for them.
Right for them, and it gives them such motivation. In fact, the gentleman we were just talking about, who asked me when he can go to the gym, and I told him, let your body be your guide. His wife, kiddingly, was yelling at me and saying, "Don't tell him that because he's crazy. He's going to go to the gym tomorrow." Well, he didn't go to the gym the next day, but he went to the gym 2 days later. And if I tell you, when he came back for his 4-week follow-up, he missed his 2-week follow-up, he was sculpted. He was chiseled. And I can't take credit for that because he did it himself. But it's a motivator. It's like when people go on a diet and they step on the scale and they see the first 5 pounds melt away, it keeps you going. It gives you that motivation. So people who go to the gym and they get discouraged because they can't get rid of those small areas, the isolated fat pockets, they get motivated again. And I can't tell you how many people who never saw the inside of a gym become gym rats because they want to keep up with it.
Of course, that makes sense. So let me see. Can I get Botox when I'm breastfeeding?
No. Chances are that nothing's going to happen. But keep in mind that Botox is a neurotoxin, and even though it stays where we inject it, say for example, we inject the forehead, we inject the glabella, I would not recommend Botox in patients who are pregnant for obvious reason, and you don't want to use it in patients who are breastfeeding. I don't honestly believe, because no one's done any prospective studies to show otherwise. I do believe it's safe, but I wouldn't recommend it, only because it is a neurotoxin.
So, I mean, it's great that you're that safe, because
Yes.
I believe there's other doctors that would say it's okay. So,
Yeah. It probably is okay, but it's better not to take any chances. I tend to be very conservative.
Yeah, no, well, that's good to hear.
Yeah.
So that kind of, and she's Daria, dang. You just got a little while longer to wait, and you look fantastic. And actually, Daria is on the younger side, so whereas I'm older and I would want it because I get the lines. A lot of people talk about the Botox as, I've lost the word.
Prophylactically?
Yes.
There was a time. There was a time where I would see patients, women in their 20s, and in my early years, I didn't feel comfortable taking care of them. I would say, I just don't see any lines, and the whole idea of Botox is to get rid of the lines. Well, in recent years, there have been studies now that show that Botox. See, I go according to the medical literature. I don't go according to Vogue or Glamour or whatever, because they can lead you astray. I go by the medical literature. And when I read the medical literature, and it does state that there is a role in prophylaxis to prevent lines, that's when I started treating patients in their 20s. And it's been shown now that if you treat patients early enough, you can actually avoid the lines from forming in the future.
Avoid or minimize?
Well, minimize. Let's be safe. Minimize.
And so you would have to, let's say you start in your 20s, you would have to continue that. I mean, right? You'd have to keep up with that for it to actually really work.
Yeah.
Right.
Well, think about it when people get their hair colored. When my wife made the decision that it was time to color her hair, she knew once she crossed that red line, there was no going back.
Right.
So think about people who color their hair.
Yeah.
Once they make that decision, you know it's an ongoing process. You don't color your hair once a year or once in a lifetime. You got to keep doing it. So that's the way you have to look at it when it comes to Botox.
So Daria says that she'll wait for her mommy makeover. You're beautiful, Daria. Stop it. All right. So let's talk about, we've touched on the Botox and the fillers. These are things that obviously women my age for sure get very excited about. So I'd like for you to talk a little bit about the fillers that you have, what they do, maybe the areas that, we aren't happy with, and you can help those.
Sure, absolutely. I was telling Marci that the Smart Lipo is my favorite procedure because as a surgeon, I love, instant gratification, instant results, and you do see it. My second favorite are fillers because unlike Botox, where you have to wait 3 to 5 days for the molecules to find the appropriate receptors to block, and that's why you need to wait 3 to 5 days. Fillers, you see the results right away. In fact, one of the things I love to do is when I treat a patient with fillers, I do one side of the face first. And I can't tell you how many times patients say, well, you're going to finish the other side, aren't you? And I say, yeah, I will, but I want you to see, because that's where it really pops. When you look at the side that's done first, and then you look at the unfinished side, it really shows the dramatic results. But, again, remember, this is not plastic surgery. This is minimally invasive, non-invasive cosmetic surgery. So our goal is to make people look refreshed, look renewed. We don't want anyone leaving the office looking completely different. So it's not like a facelift where you can tell from across the room. But I digress. Going back to fillers, what we're dealing with are basically the nasolabial folds from the Latin nasum, the nose, down to the lips. These are the nasolabial folds. These are the marionette lines that some people have. If you remember Pinocchio, the marionette puppet, when he would open his mouth, you would see the lines going up and down. You have the tear troughs that sometimes make people look tired, or people complain of dark circles.
Yeah.
And I can't tell you how upset I get when I hear these commercials about night cream for dark circles.
None of those work.
They don't
right?
work. No. You know what causes dark circles? It's the lack of volume. If you think of a hill and the sun is shining, whether it's indoor lighting or the sun outside, if you look at that little divot that we all get as we get older, we lose volume, and you think of the cheekbone as the top of the hill, and the light is shining, well, what happens on this side? You get a shadowing effect.
Yeah.
And that's what makes it appear like you have dark circles.
Don't look at mine. I know I have
You
them.
don't have dark circles.
I have them,
You're
so stop it.
You're fine.
I got the puffies.
But
for
if
sure.
we fill underneath, we call these the tear troughs, it makes those dark circles disappear because now it's even and there's no shadowing effect. So what we do with fillers is we replace the volume that's lost as we get older. You know, when we were in our 20s, we enjoyed that V-shaped configuration that we all had, the high cheekbones,
Right.
the narrowness of the lower part of the face. We didn't have the malar fat here. But as we get older, we lose the fat where we don't want to lose it, and
I know,
we get
right?
it where we do. So we go
It's
from
just not
V.
right.
Right, I know.
Not fair.
Nature is not, we should all live on the moon where gravity's 1/6. So it's
Yeah.
like it's all gravity.
Yeah.
It's all gravity.
Yeah. Well, it's too cold and there's no.
Yeah, there's no activity going on.
Yeah.
there.
Right.
But what we do with fillers is we try to restore what's lost during the aging process. And, it could be multimodal. In other words, we can use multiple things to reverse the aging process. We can take care of the lines with the Botox. We can replace the volume with fillers. We can resurface the skin with laser. So more and more now, there's less need for expensive plastic surgery. And every time I go to a meeting, you always see year after year the number of invasive procedures such as facelifts and tummy tucks are going down, and office-based non or minimally invasive procedures going up.
Yeah.
And a lot has to do with economics because it's a lot less expensive, but more importantly, people want to look natural.
Right.
As I mentioned earlier, you could tell someone has a facelift from across the room.
You really can.
Right.
Yeah.
But when people are refreshed, when they get the Botox, they get the fillers, they get the erbium peel that makes the skin feel like a baby's bottom.
That's one I really want to talk about too. That early
That's
feel.
That
sounds wonderful. That resurfacing.
Oh, wait till you get it. You're gonna love it.
Yeah.
Yeah, it's actually one of
I'm
our
gonna
favorite.
leave here.
We'll make an extra room for you. But the whole idea is to make people look rested. We want people to tell us that their friends say, "Oh, did you just get back from vacation? You look rested. You have a new boyfriend," or something like that.
Yeah.
But when people have a facelift, you can tell.
Right.
It doesn't look natural. And everyone that reads the papers saw. I forget her name, but she had a facelift and she looked totally different.
Right.
But I always kid around and saying that plastic surgeon did a great job, but he should work for the witness protection program.
Oh, God, right?
Because the person doesn't look the same.
Yeah.
But our goal with fillers basically is to replace what was lost. And that's basically filling in the volume loss. We lose fat. There's also some bone degeneration, loss of bone density along the cheek area and along the temples. So what we want to do, the goal here is to restore that V-shaped configuration. In the past, we used to just inject directly into the nasolabial and marionette, and it looked okay, but it still didn't have that natural look. We were masking the problem.
Yeah.
We weren't really taking care of the problem.
So great. So you're no longer just put the Band-Aid on it.
Exactly.
Really fixing it.
Now we fix it.
One of the other things that you had brought up that sounds really amazing is the fat transfer. So I think people would be really interested to hear exactly what that is.
Sure. Years ago, fat transfer was a lot more traumatic. We don't have they didn't have the machines back then that we have now. And the way fat was removed was using a large syringe and placing it in any part of the body where the patient wanted some of the fat removed, whether it was the lower abdomen, the outer thigh, and there was a lot of negative pressure. Now, the fat cell itself is very tenuous. It's a very weak cell with a very thin cell membrane. If you look at it cross-eyed, it'll break apart.
Yeah.
So it's very tenuous, and you have to be very gentle with it. And so fat transfers didn't really have a high success rate because just a simple mechanism of removing it causes a lot of negative pressure, and you lose the cells that way. Also, the cells themselves needed to be centrifuged to separate them from the remaining part of the tissue and then injected. And in the best of hands, the success rate was 40, maybe 45%. But now, with newer techniques, we're able to remove the fat using hydrostatic pressure, using the same numbing solution that we use with Smart Lipo.
Right.
So it's basically hitting the fat cells with numbing solution, letting them get detached from the fibrous attachment, sort of like, think of grapes on a vine, on a vineyard. And I love to use this analogy. People often ask me, why can't I use the fat that you took out with the laser? Well, those fat cells are dead because the laser destroyed the membrane.
Right.
And you can't put dead fat cells in because
Yeah.
it'll be gone within a week.
Right.
So I explain to my patients the machine we use is analogous to a garden hose. And if you aim the garden hose at a vineyard of grapes, you can knock, as long as the jet is strong enough, you can knock the grapes down,
Yeah.
and they'll fall to the soft earth, and you can collect them,
Gotcha.
and you have intact grapes.
Right.
Whereas the laser is like a flamethrower,
Right.
and you're just burning the fat.
Right.
So we collect the fat cells, and this is done sterilely, and then we inject it, and we can inject it into various areas. We can do breast augmentation. We can place it in the buttock area for buttock augmentation. We can even inject it in the back of the hands. People often say you can tell a person's age by their hands,
Yeah.
because the veins become more noticeable. And that's because of, again, loss of volume, loss of fat. So we can inject fat into the hands.
I'll just tell you, I've had my veins since I was like 10.
Well, again,
I've had my grandma's hands.
that's genetics.
So maybe that's a good one for me.
Yeah, we can't pick our parents. So DNA definitely plays an important part in cosmetics.
Yeah. Wow. So that's for breast augmentation,
Yeah.
also the backside.
Backside.
Yeah, yeah.
And it eliminates surgery because when I was still practicing general surgery and vascular surgery, one of the hardest things to do was read a mammogram on a patient who had a breast implant. Because what happens is the breast implant, whether it was saline or in the old days when they were using silicone, which is now back, now they're starting to use silicone again. You couldn't read a mammogram that well because the breast tissue would be plastered up against the chest wall. And so in today's litigious society, a lot of radiologists would send a patient with an implant right straight for a breast MRI because it's so difficult to read.
Right. Yeah.
So the advantage also is you can get a mammogram and not have to undergo unnecessary testing, and you don't have to worry about them squeezing the implants when you go for a mammogram.
Right.
And the other thing is you don't have a foreign object. You have your own
natural
tissue.
It's natural and it looks natural.
Exactly.
Just want to, there's a question here asking your name. Dr.Park Avenue is the name of the office. And she asked for your number.
My cell number?
She said ask you on a date.
Already married, 34 years, I'm sorry.
But www.parkavenue.com is the website. It has all the information on there. And he is right in Franklin Lakes, Don. So right by the Stop and Shop. Is that Stop and Shop there?
Stop and Shop, yeah.
Right.
It's called, the area is called Franklin Crossings.
Okay.
I actually live in town, unlike having to commute to the city every day for so many years. I'm 3 minutes away from the office, and I spend most of my time in the Franklin Lakes office. This is our flagship office. The other two offices are satellite offices.
Okay.
And but this is where I do the bulk of my work.
Right. So here in Franklin Lakes, and then you have one in the satellite offices are
Hoboken and in Brick.
And
I'm in Brick on Thursdays, and I'm in Hoboken
Okay.
Wednesday afternoon. In fact, anyone there from Hoboken, I'll see you this afternoon.
Yeah.
Later in the afternoon. And I'm also in Hoboken on Fridays.
Yeah.
And I'm here also on Saturdays because I'm 3 minutes
that's
away.
Great. Yeah, on the weekends.
Yeah, I could do a quick smart. I'm sorry to interrupt.
Oh,
but
no.
I could do a quick smart lap on Saturday and be home in 3 minutes.
So right. So just to think about that, the procedure is very quick, and then you can leave, and it's there's no surgery. So so just to be also very clear, there's no surgical procedures done.
Correct.
Right?
I haven't made an incision since 2007.
Okay.
When I made the decision to
Right,
go
right.
strictly into cosmetics.
And it sounds like you don't really need to.
No.
Right.
In fact, you mentioned the holes. They're really just punctures.
Punctures.
And they're so small. And one of the other advantages that I failed to mention is they're so small that there's no need to close them.
That's
And the
right. This is with the
advantage-
smart lipo.
With the smart lipo. And the advantage of that is because they're not closed, any leakage that comes out is caught by the dressings that we put in, which the most important thing of all is no infections.
Yes.
Knock on wood. Well, that's metal, but knock on wood here, we haven't seen an infection since we've been doing smart lipo by leaving these little puncture wounds open. Because one, the laser sterilizes everything inside, and number two, should any bacteria happen to find itself inside, there's no room for it to stay in there. Everything leaks out. And by leaving those little punctures open, we don't see infections. And we learned that from years past when we started doing laparoscopy through the navel for gallbladders. We realized that it was the wound that caused infections.
Right.
It wasn't what we did inside,
Right.
but the wound itself. And so, and the holes, by the way, close the following day. So when you take your shower the next day, there's no need to put any new dressings. Once in a blue moon, we tell our patients if the openings look a little wet, just put a Band-Aid on it.
Okay.
That's it. But for all intents and purposes, within 24 hours, those little punctures are closed.
Wonderful.
Yeah.
So, Dr. Fondacaro, I'd like to take everybody on a little tour of your office
It'll be my pleasure.
and show everyone where you do your magic.
Absolutely. It'll be my pleasure.
So, I will be behind the camera here
Uh-huh.
and follow you. This microphone out.